Hey guys, Josh Nimmo from CrossFit Metro-East again. Dr. Jordan Vickery as well here. We have a couple things that we're going to talk about today. Starting out just with a kind of case and a question that a lot of us coaches get is, hey, I'm having trouble with the overhead squat. And I get it all the time. Now, we are lucky enough here that we have someone like Dr. Jordan here a couple days a week that we talk to Dr. Jordan all the time about movement and how to get better at a certain movement. And hey, somebody's maybe not necessarily tight in a certain area, has an injury, but hey, this person just wants to get in a better position in like the overhead squat. So one thing that we talk about is, as coaches, is how do you tell? Is it upper body or lower body that's causing the kink in the chain on squatting? So I was talking with Dr. Jordan here, and he had just a quick test to kind of evaluate, hey, can this person squat, can they not? So you want to kind of explain the test to us?
Absolutely. First, I want to preface that if you're an athlete, it's not your job to tell what your issue is. Talk to your trainer, talk to one of your professionals, talk to someone like me, talk to your own doctor. I don't care who it is, but don't take that on yourself to know what your issue is. You always need that extra eye. I can't determine what's wrong with me. I have to have someone watch me do it because they get a way better view than what I think I know myself.
Sure.
So this is more for coaches and trainers. So what I want you to do to determine if it is upper body or lower body is just break it down to just a squat. Now, if you say, all right, well, let me see you do a squat. Can you do this squat with your heels on the ground? And you see someone start to squat down and their knees cave in, but their heels are on there, too many people are going to say, yeah, that looks good, you can do this. Wrong. You are not doing a very good squat if you're doing it like that.
Yeah.
So what I like to do is what I call the toe squat test. So what I'm going to have him do is I'm going to have this athlete squat down just on his toes in a very comfortable, normal squat on your toes. Okay, so the way you're looking at here is you see a pretty well a 90-degree angle right here. Well, to get into a nice flat-footed squat, you're going to have to be able to rock back onto your heels and decrease that angle so that his leg is going to come up and his femur is not going to be parallel anymore. It's going to be more angled upward. So go ahead and lean back on your heels to see if he can get into that squat without rounding his back. He is fully balanced in this position. You can see his back is a nice straight line, and you can see how this leg went downhill just a little bit. So with this athlete right here, I can confidently say that if he has trouble with overhead squat or snatches or anything like that, that his problem is not upper back, or his problem is not lower body, it is upper body. So, say your athlete can't do this. Now I want to talk about what are some areas that can happen. Well, for purposes of time, we're just going to go over one thing that could be hindering this athlete from getting into an adequate squat, and that is quad length. Too many times that is overlooked because you're going to have a lot of people that feel like they have that pinching right in the front of their quads. Okay. So let's just show a real quick test on how to determine if this athlete has quad length problems or not. So laying on their stomach, all I'm doing is just very, very relaxed. You're taking their foot to their back. How far is their heel from their butt? I can get about 1 fist length in there. I want to see if it is more than 2 fist lengths, they have some issues with their quads. Now it's a question of, well, how do you treat that? How do you gain that length if someone is all the way at 90 degrees and can't get any further down? And Josh, one of his preferences, and I completely agree with this, is warming up before you stretch. Getting blood flow to the tissue that you're trying to stretch out. Yeah. You're not going to have a good, valid stretch without adequate blood flow through the area. And that's as simple as just foam rolling.
Yeah. So we got a foam roller around here somewhere. Yeah, here we go. So on that foam roll, guys, it's super simple, but all we're going to do is, I got the mini guy here, but I'm going to keep my other leg off to drive, and I'm going to just roll all the way up and down the quad. And I think that's important too. I see too many times I get somebody and they're just rolling, and they're over about this much of a muscle that's about this long. So we really need to go from the top of the knee, not over the kneecap, but from the top of the knee all the way up the length of the muscle. And it's not going to hurt you to get up into that hip a little bit, okay, and roll back down. Now, Dr. Jordan likes if we hit a little gnarly spot and I kind of hit a knot, I feel, oh man, that's kind of stiff there. is this rock back and forth.
You can
Okay.
rock back and forth, or you can do a form of attack and stretch. You can just get on it and then start pumping that
Bend
leg
back
up and down.
Yep. Okay. Both great ways to hit. Now, on that foam rolling, remember, we're just trying to create a little blood flow here. So it doesn't need to be much more than about 4 or 5 minutes, I believe, you know. And really, I hit 2 to 3 minutes, boom, I move into my stretch. Now, show us that stretch that we're talking about for the hip, or for the quad, I'm sorry.
So what I'm going to do is I'm going to put Josh in this stretch, and I want him to think. You have to think about what you're doing. And one of the main benefits of stretching is doing it alone, doing it with your mind set on stretching.
Mm-hmm.
If you're talking with your buddies and you're just cutting up, having a good time, chances are you're not really getting into that stretch, and it's not going to give you as full of the benefits. You're more wasting your time as opposed to actually getting to the heart of the problem.
Okay.
So we're going to kind of show a little bit of variations of the couch stretch. I know everybody's heard of it and everybody's probably done it, but there are ways of doing it correctly and ways of doing it wrong to get more of a benefit for you individually. So what I'm going to have him do is I'm going to have him get up into the couch stretch, and I'm going to have him put his knee and shin completely vertical to the box. I want the knee touching at the bottom of that box. Now with the other foot, he's going to get up into a squat position, and he's essentially getting a 2-for-1 here. He's getting some stretch to his groin and to his hip rotators, and he's also getting the stretch on the quad, which is what we're trying to focus on. Now, in this position, as opposed to sitting up straight and cheating with some low back flexion, what I want him to do is I want him to drive his hip down toward the mat. So as he's pushing that hip down, he's also contracting this glute. What that's going to do is that's going to start opening up that connection of the quad there. It's going to hit that high quad, and it's going to start really hitting where it ties into the pelvis. Because you got to remember, this muscle, this specific muscle, the rectus femoris, crosses 2 joints. It is not just attached to the thigh itself. It is attached to the pelvis. Okay, you're going to hold that 2 minutes. It is a terrible, terrible stretch if it hurts you, or I mean, if it is a necessary stretch for you. But now let's make it a little bit worse. Now, before he goes into this, I want you to understand this is not something you just start with. You have to progress to these things, otherwise you're overextending that muscle, and you could be doing more harm than you could be doing good. So always start lower, work your way up as you feel it progressing. So he has that band way up into his high hip there, because what that is doing is that's pulling that femur forward in the socket, and it's actually stretching some of the connective tissue, not just the muscles itself. Again, you're either going to try to force that hip to the ground, or you can get more erect, as long as you're not getting too much lumbar flexion.
And one great way to just think about that lumbar flexion point is if, I'll get out of the band just to show it real quick, is either I can be in a flexed hip position here, and I got that belly out, I can tie that rib cage in. So I just kind of,
Yes.
I tell my guys, think about pulling tight the suspenders and stay tight here. Once you tighten this glute here, that's going to really pull those hips under, and now I'm set up. Now obviously that's that foot being up on the box too. So that's one great way that I kind of talk to my folks about keeping that belly tied down, tightening down the suspenders on the straps.
And another thing, you are an individual. Your stretch is not going to look like Josh's stretch. So if you're here, and this is all it takes for you to feel a really good stretch right there, that's all you need right now. You don't have to force yourself all the way up here just so that you look like him while he's stretching.
Yeah, absolutely. Okay, so hey, that's the quad length there. Remember, those are 2-minute holds on that stuff. A little bit of foam rolling right before helps to kind of just increase that blood flow. We'll be back with you again next week on talking about some more components of the overhead squat, or just the squat in general, talking about some hamstring things and different things like that. So we'll see you next week. Thanks again. Dr. Jordan's here on Mondays and Wednesdays at CrossFit Metro-East. And look forward to hearing something from you in the comments on anything you have questions on. Thanks again, guys.